Today we're going to go over the protocol for laser vein removal. First, we're going to switch out the handpiece. Laser vein removal requires a specialty handpiece. Switching out the handpiece may require 2 people. Pull out each individual cable from the machine. Always pull the cables straight out. Do not turn the cables when removing them. It may damage the connectors inside. Remove the cable cords from the clip. Always hold the cables in a big loop when handling them. These are fiber optic cables and can break very easily, costing thousands of dollars to replace. Press the button on the right side of the handpiece to remove the current spot size. Connect the vein specialty handpiece by clipping in the cords and pushing in the cables. Do not turn the cables when inserting them because it may damage the connectors inside. On the GentleMax Pro, choose the correct YAG wavelength. Do not use Alex. It will hyperpigment the client. Under the YAG Applications drop-down menu, select Vascular Lesions. Choose your client's parameters for treatment type, either face veins or leg veins, vessel size, which is the measurement of the vein, and their Fitzpatrick skin type. For the spot sizes, choose between a 1.5, 3, or 3 by 10 millimeter. The spot size depends on the width of the veins. The smaller the vein, the smaller the spot size. On legs, you can go down to a 1.5 millimeter. Never treat a face at a 3 millimeter because the depth is too much and it can scar their face. 3 by 10 millimeter is used primarily for linear veins. Cooling settings are on the right side of the screen. The top buttons are for pre-cooling, middle buttons are for pulse cooling, and the bottom buttons are for post-cooling. On the client's chart, always notate which settings are being used during the treatment. Each treatment, you may increase the joules. Clients can expect 3 to 5 treatments. Veins are treated every 8 weeks because it takes the body that long to carry out the dead blood vessels. We don't want to treat a vessel until we know it's fully healed in the area. Now we're going to prep. Put on some gloves. Have a soft cloth, alcohol, and white eyeliner ready to go. Sharpen the white eyeliner before and after use. Put the proper spot size on the handpiece. Make sure the lens inside the spot size is clean before and after use. To clean the spot size, wipe it with alcohol and then dry it. If it's not clean, it'll burn the client because it will target the spot on the lens versus the skin. Now, calibrate the settings. It must be calibrated with the handpiece inside the port. Place goggles on the client and have a pair ready for yourself. Wipe the treatment area down with alcohol to fully cleanse the skin. Once the machine is calibrated, place the proper distance gauge that matches your spot size on the handpiece and begin the treatment. Anytime you need to move the handpiece closer to your client, move the device with the handle or tug from the top of the cable cords. Never pull with the handpiece because you can damage the cords. Circle each vein with white eyeliner as you go. Marking the veins is very important to ensure you don't miss any or go over the same vein twice. Hover the distance gauge right on top of the skin. Do not press down with any pressure because the vein will constrict and go away. Always work towards the heart, but leave some space between pulses. You do not want to stack the hits on top of each other because the laser spreads, and you don't want to double hit the spot right after each other. Typically, you will see the vein change color very quickly. You're looking for it to become a darker red or purple. Bruising or cat scratch swelling is normal. If you don't see the color change, it means your joules needs to be adjusted. For very tiny veins, you only need to hit them once in the center of the vein. When you finish a vein, hit standby on the handpiece so you don't accidentally fire while holding the laser to outline the next vein. Lasers can only see color, and the chromophore for veins is blood. If you can barely even see a vein, do not touch it because you risk a chance of burning the client's skin because the laser won't be able to find the vein. Do not touch any blue veins. Blue veins are active working veins for circulation. Lastly, do not touch any bulging veins. Wipe the white eyeliner marks off the client's skin using a soft cloth and water. Now let's go over the cleanup protocol. Sharpen the white eyeliner. Use alcohol and a soft cloth to wipe down the goggles, distance gauge, spot size, and the lens. Don't use cavi wipes. Place caps on the spot size before putting it away so dust doesn't get inside. Switch back the handpiece. Make sure all surfaces are wiped and ready for the next guest.